Introduction. Technological innovation has yielded truly remarkable advances in healthcare during the last 5 decades. In recent years, breakthroughs in a variety of areas have helped to improve healthcare delivery and patient outcomes, including antivirals, such as the discovery of remdesivir, a broad-spectrum antiviral drug, now used for the treatment of COVID-19. Anti-clotting drugs, such as rivaroxaban, an anticoagulant used to treat deep vein thrombosis and pulmonary emboli. Anti-diabetic drugs, such as the first and only inhalational rapid-acting insulin, Afrezza. Antihypertensive drugs, such as firabastat, an alternative antihypertensive approach, which can interfere with the mechanisms involved in the genesis and control of blood pressure. Antirheumatic drugs, such as adalimumab, a monoclonal antibody, TNF-alpha inhibitor used to treat rheumatoid arthritis. Vaccines, such as the development of vaccine for COVID-19. Pharmacogenomics and targeted cancer therapies, which aims to tailor medical treatment to each person or to a group of people. It looks at how your DNA affects the way you respond to drugs. Cardiac rhythm management, a procedure wherein a device is implanted within the upper chest, to control both fast and slow cardiac rhythm, by using electrical pulses. Diagnostic imaging, such as MRI, a medical imaging technique that uses a magnetic field and computer-generated radio waves, to create detailed images of the organs and tissues in your body. Minimally invasive surgery, such as endoscopic surgery, performed using a scope, a flexible tube with a camera and light at the tip. Joint replacement, a surgical procedure in which parts of an arthritic or damaged joint are removed and replaced with a metal, plastic or ceramic device called a prosthesis. Pain management, such as patient-controlled analgesia, a method of pain control that gives patients the power to control their pain. Infection control, such as the wearing of personal protective equipment or PPE. And health information technology, such as the use of patient barcode, which helps streamline the patient admittance process, track medication and care admission, and identify patients throughout their entire stay. The proliferation of healthcare technology and its expanding uses have contributed to growing healthcare costs, and the former has been cited as culprit for the latter. However, this relationship is variable, complex, and evolving. Few patients or clinicians are willing to forego access to state-of-the-art healthcare technology. In the wealthier countries and those with growing economies, adoption and use of technology has been stimulated by patient and physician incentives to seek any potential health benefit with limited regard to cost, and by third-party payment, provider competition, effective marketing of technologies, and consumer awareness. In this era of increasing cost pressures, restructuring of healthcare delivery and payment, and heightened consumer demand, yet continued inadequate access to care for many millions of people, technology remains the substance of healthcare. Culprit or not, technology can be managed in ways that improve patient access and health outcomes, while continuing to encourage useful innovation. The development, adoption, and diffusion of technology are increasingly influenced by a widening group of policymakers in the healthcare sector. Health product makers, regulators, clinicians, patients, hospital managers, payers, government leaders, and others, increasingly demand well-founded information to support decisions about whether or how to develop technology, to allow it on the market, to acquire it, to use it, to pay for its use, to ensure its appropriate use, and more. The growth and development of health technology assessment, or HTA, in government and the private sector reflect this demand. HTA methods are evolving, and their applications are increasingly diverse. This module introduces fundamental aspects and issues of a dynamic field of inquiry. Broader participation of people, with multiple disciplines and different roles in healthcare, is enriching the field. The heightened demand for HTA, in particular from the for-profit and not-for-profit private sectors, as well as from government agencies, is pushing the field to evolve more systematic and transparent assessment processes and reporting to diverse users. The body of knowledge about HTA cannot be found in one place and is not static. Practitioners and users of HTA should not only monitor changes in the field, but have considerable opportunities to contribute to its development.